everyone, my name is Lam Sin Yu. Today we would like to introduce occupational health, and our main topic is osteoarthritis. According to our literature review, we found that there is a high incidence rate of osteoarthritis in men, especially for whom working in industrial industry. Moreover, with aging, the rate of osteoarthritis is increasing. And then in terms of the situations of osteoarthritis, osteoarthritis affects about 1 in 10 adults. 15% of the world population is a significant factor of long-term pain and disability. Knee osteoarthritis is the most common type of osteoarthritis, and degenerative disease causing disabilities in elderly patients. And then I would like to pass the time to Fok Hiu for introductions the symptoms of osteoarthritis. Thank you.
About the symptoms of people who have osteoarthritis, they may feel pain during or after the movement and loss of flexibility. Moreover, when using the drug, they will feel a grating sensation. Furthermore, it may cause a swelling by soft tissue inflammation about the cell. The definition of osteoarthritis means it is an inflammatory disease of the increased synovial joints. Also, it will change the structure and function of the cell, including the synovium or subconscious bone. Now let's pass to the session to April.
For the effect of osteoarthritis, bone may break down and develop permanent osteoarthritis gets worse. International abscess majors contractiles of mobility, disability, and incommate cause. Individual abscess affect sleep, daily function, life expectancy, and sexual statifications. Osteoarthritis cannot be healed. The treatment only focuses on reducing symptoms, prevention of progressions, and improve quality of life. For the big ideas, we have two challenges. Internal challenges are to understand the promote activities, promotion methods, and the time management. External challenges are the way that funds concentration science supports activity by use the identity of a student they will trust us or the safety in the contraction sites. Let's pass to Bobo.
About our guiding activities, we do some research about the information of osteoarthritis, include the situation of Hong Kong, the effects, prevention, and monitoring of osteoarthritis. Also, we found Yunlong construction site as our activity location. We used the questionnaire to collect the data and the following procedure. This is our rundown of the activity. Our activity around 1 hour. We'll do the self-introduction, briefing, and interview in the first 50 minutes. After that, we'll use the phone board to talk about the prevention methods. In the following 25 minutes, we'll demonstrate the formal exercise and do the group practice with supervision. Lastly, souvenir will be given. Let's pass to Chloe to talk about the guiding question and resources.
We have some guiding questions. The first one is whether the construction worker understand the occupational health issue about their job to determine their level of health awareness and knowledge. The second one is the knowledge of preventing osteoarthritis to know the level of alertness of joint disease. The last one is whether the construction worker know how to promote related health knowledge to their colleagues if they know they can be the health ambassador in the workplace. We also get some advice from experts. Dr. Cheuk Yin, who is an expert from orthopedics and traumatology, he said stretching is an effective physical measure. Also, enough rest can prevent overuse of joints, and construction workers need a correct posture of lifting heavy things. Lastly, he said we need to encourage clients to change their lifestyle and habits. We have also found some guiding resources such as poster from Labor Department, which talks about the occupational diseases and work-related disease. In the poster, there are cause, symptoms, and preventions. Next, pass the next session to Gloria.
It is obvious to see that as we have little understanding on the promotion activity as we haven't tried it before, so in order to gain a deeper understanding on occupational health, we have to do some literature review in order to prepare well before the activity. We have learned some warm-up exercise such as leg straight position and stretching exercise in order to teach those workers during the activity. Also, we have listened to some talk and other experts' advice related to osteoarthritis in order to deliver accurate health knowledge to those workers. As most of us haven't organized a health promotion activity before, so we have no idea on how to deliver those health knowledge in a simple, concrete, and comfortable way. But after we have watched some videos from other experts, we find that demonstration can be an effective way to be used, as under both visual and audio information, the knowledge has become permanent, so it will make them easy to be remembered. Next, I will pass the session to Kali.
Thank you, Gloria. So, in external challenge, we have prepared by good practice before the program. It can reduce time wasting by preparing a simple questionnaire which is easy to understand. Also, animate information phone board and leaflet can provide well-managed information and flow of the education talk. As you can see in the right side, the phone board which is designed by us. Moreover, we will have research and interview with experts such as doctors to provide more useful and trustworthy information to make sure those workers reaches our suggestion. So, in the safety, in the construction site also is our external challenge. Therefore, site visits before the program is necessary. We will familiarize with their working environment and the nature of their job. We can ensure our safe in the program by check the safety in the construction site, whether the clear of the environment, and make sure we will not getting any injury during the activity. So our safety is the most important thing in the health promotion, as well as our responsibility to school and the construction site by reduce the risk of getting any injury and make sure we will be safe. So I'll pass the next session to Yumi.
I'm going to talk about how the futures with the workers. We are using the identity of nursing students. Some of us had worked in the Scotland that can show the workers some similar experience. Before the interview, we have already found the professional research and the advice from the expert. Then, I'm going to show you some videos and the photos that are about the site visit and the interview what we did. And this is our good photo with the workers. On the top left hand side is the site visit 30 minutes, and the white one is the question out, around 10 minutes. And we also have the 5-minute health talk. The middle one is the demonstration of the warm-up exercise, 10 minutes. And the last part is the 15-minute interview. Okay, let's move on to the videos.
Nam Mi Tho Phật. Nam Mi Tho Phật.
present the part of evaluation. In assessment part, we want to know more the workers, or they know about the predisposed factor, prevention method, and relative measure towards this disease. In data collection procedure, we have adopted two methods to gather information. First is the interview. We ask about the basic information, natures of work, the problems encountered, and about their awareness towards the osteoarthritis. Secondly is the observation about the environment of their construction site, the protective measure, and are there any poster or leaflets about this disease. The protective measures means the assistance machine and the safety clothing to protect their joints. Finally, after the data collection procedure and the promotion, we will ask them to demonstrate the safety measure and the correct posture to their colleagues while working, and we will ask them to point out the wrong posture of their colleagues and help them to correct it. Thanks, and let's pass the time to Joyce to present the part of evaluation method.
Thank you. Next, we are going to talk about the evaluation method. We would like to check whether the workers has increased their alertness of joint disease related to their job. Before the health promotion, we assess their level of understanding about joint disease, and most of them have lack of knowledge about osteoarthritis. After teaching them, they are able to tell the signs and symptoms of having osteoarthritis and different types of them. Also, we would assess whether they learned how to prevent joint disease related to their job. Before teaching, we would do a quick test by showing them some pictures and ask them about the safety measures that are shown. However, we discovered that they have no level of awareness for protecting their joints. After teaching them, they are capable to describe the safety measures and correct posture of lifting heavy things, and understand the importance of preventing occupational injury. Finally, we will evaluate that if they can become one of the ambassadors to tell others the information about the joint disease, especially the prevention methods. Before teaching, we observed that there is no health supervisor in the construction site who can remind others to stay away from occupational injury. After teaching, the worker learns the warm-up exercise and teach their colleague about the prevention method of the osteoarthritis. Next, I will pass the time to Chung Yin.
It comes to the part of result and discussion. We have prepared two sets of questionnaires for the pre-promotion assessment and post-promotion assessment. As you can see in the pictures, our group may separate and task different workers in the construction site. The questionnaire includes some basic information of the workers, such as their age and gender. Also, we predict some of the problems they might face with osteoarthritis. For the pre-promotion questionnaire, we have conducted 8 interviewees and all of them are male. The age distribution of them is even, 2 in different age range as you can see in the graph. All of them are having a problem of long working hours and need to maintain the same position with handling heavy objects. 7 out of 8 are having knee joint problems. Other joints problem is much milder than that. We have also conducted a pain score of them. Workers below 50 years old are having a score average at 7 out of 10, which that means it's a very intense pain. However, the 2 workers who are aged 50 or above have only scored 2 out of 10, which means they have a long-term suffering and develop in the pain tolerance. This is very dangerous for them not to aware the problem before osteoarthritis get worse. With no surprise, there's only one of the workers who will do some warm exercise, and most of them never consult a doctor with their osteoarthritis. They will try to stretch and take rest with using some over-the-counter OTC drugs to relieve the pain. We try to implement a health belief model to a part before health promotion. Perceived susceptibility. The worker understands the impacts and cause of osteoarthritis. Perceived severity. They know they get high risk in developing osteoarthritis and suffering from the complication. Perceived benefit. They don't think stretch can help with and reduce the suffering of osteoarthritis. And perceived barriers. Due to busy working time, the workers may do less stretching exercise. So, cue to action. They don't want to take action to do the exercise because it's not useful. Finally, for self-efficacy, no person's confidence and belief in their own ability to do the exercise. Here are passed to Molly.
To evaluate the effectiveness of our health promotion on osteoarthritis related to occupational health, an online questionnaire has been designed and delivered with QR code, which is more convenient. Eventually, we got positive feedback from those construction workers. For example, most of them understand the prevention of OA and the complication of osteoarthritis. Also, we interviewed two participants. The first one is Mr. Choi, who said he feels less pain and suffering due to the knee osteoarthritis after performing the stretching exercise. And on the other hand, Mr. Yin said after the exercise, a deeper understanding of preventing osteoarthritis and occupational accidents was built. Hence, by comparing the health belief model before and after our promotion, there is a significant change in perceived benefits, barriers, cue to action, and self-efficacy. By teaching some stretching exercise, those workers understand this exercise can help them to relax the muscle and prevent the osteoarthritis, as well as it just takes few minutes that increase their willingness to perform this exercise. Those workers understand OA can be prevented, so they do the stretching exercise with their colleagues regularly and modify their lifestyle, especially the eating habits. To sum up, occupational health is very important to everyone, and the occurrence of OA due to low awareness of joint protection. And it is better for us to combine health talk and demonstration the exercise during the promotion. Thank you for your attention.